Hello, I'm Dr. Martin. I'm an interventional pain doctor and have been for 25 years. I'm also an expert in the field of regenerative medicine. Your provider has asked me to speak to you today to explain a bit more about some of the regenerative therapies that you might receive in their office. Now, one of the therapies you may receive is an umbilical cord tissue-derived product, something called Wharton's jelly, or could be a Wharton's jelly-derived exosome. You may have heard of these referred to as stem cells. In scientific circles, we call them human cell and tissue products. I'm going to be speaking briefly about those, give you a bit of background information, and discuss how these might be beneficial in your recovery. Now, all of us experience pain from time to time. Knee pain, shoulder pain, back pain. And I'm 53 years old, and believe me, I suffer with a fair amount of that. I've been very active my entire life. As we age, our body has a wonderful capacity to repair itself. But unfortunately, as we get older, that reparative capacity tends to wane. It isn't quite as robust. Now, if you need proof of that, try to think back to when you were 2 or 3 years old and think about how you felt after you fell. And this was a very traumatic accident. Most of us can't recall falling when we were 2, 3 years old because we just bounced up and went on with our day. Well, at my age, at 53, if I fall, I pretty much want to lay down and take a nap because it's going to take me a minute to recover. And even though I exercise regularly, at 53, my body doesn't repair itself at a cellular level the way it used to. Now, I explain this in terms of a bit of a pyramid, right? Now, at the top of the pyramid, we have function. All of us want to function optimally. We want to function well in our lives. We want to function well at work. We want to function in our recreational activities. But in order to function optimally, there are 2 other caveats in this pyramid, right? One of them at the bottom left is inflammation, and one of them at the bottom right has to do with collagen and our body's ability to repair itself at a cellular level. Well, let's talk about this pyramid a bit, right? If I want my body to function optimally, what does my body need to do? Well, number one, I can't have a whole lot of inflammation. If I have an inflamed knee, can I go run? Can I play golf? Can I play pickleball? Can I go to work? I can't because it hurts too much. I need that inflammation to calm itself, and then I can return to activity. Now, most of the things that we use to calm inflammation are drugs. They're approved by the FDA to treat a condition. These are things like Celebrex, Mobic, over-the-counter drugs like Motrin, Advil, Aleve. They have a specific indication to treat inflammatory issues. Other drugs you're familiar with, prednisone, cortisone. Most of you may have had cortisone shots, a steroid to remodel inflammation, reduce inflammation, to ideally treat pain and improve function. When we're talking about human cell and tissue products, when we're talking about stem cell derived products, and I use stem cell in quotations because these products aren't what you might think. These products from an umbilical cord, they're not magic. They're not a Harry Potter magic wand that just levitates health. What they are, at an essential level, is a product that will down-regulate inflammation potently without treating a disease process, but they do not break tissues down in the process. They are actually anabolic in nature. But number 2, those umbilical cord derived products have collagen-based subunits, the essential collagen-based subunits that are present in every one of the joints in our body and including the intervertebral discs in our spine. And unfortunately, as we age, our bodies stop making those essential collagen-based building blocks. Let me explain. Your knee joint, your shoulder joint, your hip joint, the joints in your hands, the joints in your wrists are made up of 3 different types of collagen. Collagen type 1, collagen type 3, and a little bit of collagen type 2. Now, at the age of 20, at the age of 25, our bodies stop making type 2 collagen. That's a problem, right? Because that collagen, that articular cartilage, is present in every one of our synovial joints. It's also 90% of those cushions in between the bones in our back. Type 2 collagen makes up 90% of the nucleus pulposus, and our bodies stop making it at the age of 20 or 25. What about the other collagen subtypes in our body? Well, if we look at, say, the meniscus of our knee, everyone's heard of somebody who tore their meniscus. That collagen is type 1 and type 3. And unfortunately, our bodies stop making collagen type 3 at the age of 30 or 35. So me, being 53 years old, if I decide to go out and play tennis and I tear my medial meniscus, my body does have the ability to heal itself at a cellular level. The problem? My body doesn't have a robust ability to down-regulate inflammation, and that injury is definitely going to cause inflammation. But number 2, my body doesn't make 2 of the essential collagen subunits that my body needs to fully repair the cartilage around my knee joint. My meniscus is type 1 and type 3 collagen, but my body only makes type 1 collagen. The articular cartilage above and below that meniscus would have certainly been injured by inflammation or by the trauma of the accident, and that can start to break down some of that type 2 collagen. But again, my body doesn't make it at the age of 53. The reason the umbilical cord derived products that your provider may offer are so impressive, are so storied, is that those umbilical cord derived products contain type 1 collagen, type 3 collagen, some type 2 collagen, and they have the ability to down-regulate inflammation without breaking tissues down. This is wonderful, wonderful, especially for somebody like me who's very active and tends to get injured more often than I would like. None of these products are regulated in the same way as drugs. So they're not used to diagnose, to treat, to cure, or prevent injury. Think of them more like fuel. Your body is no different than a car. If you want your body to continue to run, it needs fuel. It needs water to stay hydrated. Your body needs glucose, food, to stay nourished. But at a cellular level, your joints also need the collagen-based building blocks, type 1, type 2, and type 3, so they can repair themselves at a cellular level. You can supplement those collagen-based defects with things like umbilical cord tissues. Now, we're not treating the underlying disease. We're not treating osteoarthritis. We're not treating rheumatoid arthritis or psoriatic arthritis. Those are systemic diseases. These umbilical cord tissue-derived products aren't drugs. They are regulated in a completely different way by the FDA. They're FDA cleared as a supplement to cartilage-based defects. They are a structural tissue, but they don't treat disease. And this is important. Some of you may have systemic diseases, lupus, Sjogren's, rheumatoid arthritis, psoriatic arthritis. All of those diseases may require drugs. This is not a primary treatment for those diseases. This is an option. Because even on all those drugs, your body still may not be functioning optimally. And you may think to yourself, well, maybe more drugs is an option. Maybe cortisone shots are an option. Maybe surgery is an option. All of those are options. But your provider specifically offers a regenerative therapeutic that isn't steroids or drugs or surgery. And that regenerative therapy isn't going to treat the underlying disease process, but it may downregulate inflammation, and it may supply the essential collagen-based building blocks in a structural manner that your body can utilize to repair itself at a cellular level. Final note. At 53, my body repairs itself slower than it did at 10, 11, or 12. And everyone's body is a little bit different. Some of us have other problems. I have thyroid disease. I also have a very bad back. And because I have other medical problems, it isn't always the case that a single application of a biologic is going to improve your function. You may need multiple applications because everyone's body repairs itself at a cellular level at a different rate. Some slower, some quicker. Now, we certainly hope that a single application might be experienced by you as a precipitous improvement in function or quality of life. However, it may take 2 or 3 applications. And if you do get feeling better and you're back to playing golf or tennis or pickleball, is it possible for you to injure yourself? Well, sure. You may have put fuel in your car and you may be driving along and you can get in a car accident. 2 days later, you can get in another car accident. That doesn't change the requirement for fuel to make the car run, because you can always get in another accident. We can eat the best food. We can have an anti-inflammatory diet. We can eat 100 grams of protein a day. It doesn't mean that if we don't see a curb, we're not going to trip over it and injure ourselves. It doesn't mean that when we go to pick up a flower pot in our yard or pull weeds or simply walk through the parking lot that we may get in an accident. And at that point in time, it may be necessary to repeat an allograft application. And your provider will discuss that with you. Obviously, we certainly hope that you stay well and you stay well in perpetuity, but unfortunately, life happens. One final note. Your provider, like me, will always encourage you to read around the application of biologics, and we invite you to do your own research. These regenerative therapies are not a drug. They are not approved by the FDA. They are an option to drugs. They are an option to surgery and things like cortisone applications. They are there to work with your body. They are there to supplement collagen-based defects. They are there to supply some of the essential collagen-based building blocks so your body can repair itself at a cellular level. And you should do as much research as you can so that you're informed, because ultimately that is what we care about. The evidence-based application of regenerative medicine therapeutics. In this way, you can have open dialogue with your provider and you'll both be on the same page about what might be an option for you and how you may proceed to get back to the quality of life that you want to pursue. I'm Dr. Martin. It's been lovely speaking to you. Good luck and good health. Have a blessed day.